today. Today, we are happy to welcome our colleague, Dr. Esther Tan from the Public Health team in DHMOSH. Dr. Tan serves as Senior Medical Officer and Head of the Public Health Section in DHMOSH. Her responsibilities include advising the United Nations on outbreak response and leading and management of public health issues for the UN staff workforce and peacekeepers globally. Since she joined the UN in 2006, she has held various positions, including in the Office of the Medical Director and in the Office of the Special Envoy of the UN Secretary General for the Ebola. Prior to the UN, she served as Epidemic Intelligence Service Officer with the U.S. Center of Disease Control and Prevention and Assist Director in the Ministry of Health of Singapore. She graduated from University College London and is a medical doctor, qualified physician, graduated in 1998 and received a Master in Public Health in 2003 from Harvard School of Public Health. Thank you for being with us today. Esther, the floor is yours.
Thank you so much. Hi, good morning, good afternoon, all of you. Thank you for joining us today. So today we're really happy to launch a platform, especially for the field, that will be able to enable you to report to us all kinds of outbreaks that you experience. And this platform is something that it's going to be open up to the peacekeeping missions as well as the UN clinics. And you can easily use it. It is accessible through the internet, and I'll be demonstrating it to you today. This platform actually was based off the COVID experience. So as those of you know, you've been entering a lot of information about COVID outbreaks into this platform. And what we did was, using this COVID platform, we adapted it to make it applicable for all kinds of infectious disease outbreaks that you might experience. So we expanded it basically. I think right now, in terms of the access to this platform, we have the CMOs and UN clinic doctors that have access to it. But if you need other focal points to have access to it, you can tell us and we will add you into the list, okay? So we will send all of this information out to you by email so that everything is clear, and there will be a clear video introduction as well, so that it will walk you through the system and how to use it. It's very easy and it's very simple and to use. So let me share my screen, and then you can see what the system looks like. Okay, so what you will find is that you will just open this web link, and if you are one of the focal points, you'll be able to see this page. And when you get to this page, hope you can see. So you get to this page, you'll have two boxes. One is going to be for the DPPA, DPO field missions, and the other are non-mission locations. So if you're one of the UN clinics that are not in the peacekeeping mission, you should use that. Also here, it has our contact information. Please contact this email if you have any comments or questions. So both forms are identical. I'm just going to open up one of them. So you'll come to a screen here where you'll say you want to add a new outbreak or you want to update existing outbreak. So for now, we're going to add a new outbreak, and I'll click here. On the top right, you'll see instructions as well. If it's the first time and you're not familiar with this, you can open it up and you can see a screen here that tells you how you should complete the form. So I'll go over this with you. So basically it says here, this form will provide senior management of the UN with a snapshot of all currently active outbreaks involving personnel in your duty station. Please complete the form as much as you can based on your information. Please submit this form online when you have an outbreak to report. And how do we define an outbreak? So we define it as, really, an outbreak is defined as disease cases exceeding what is typically expected in your community in your area or for that season. So for example, if normally, if for example, Ebola is a good example. You normally don't have Ebola, but if you have one case Ebola, then you should report it. Even that one case is considered an outbreak to us. Or normally, let's say you don't have many food poisoning cases, but all of a sudden, you have one contingent that a lot of people are getting sick, then you should report that to us. Or for example, if you normally don't have a lot of influenza, but a community is suddenly an office, a lot of people are getting sick from that, you should report that to us. So for any questions, you can contact us here. So whenever you see this top right button, this blue and yellow button here, that's where the instructions that will come out that you can take a look if you need to, okay? So I'm going to click this, add a new outbreak. So it's very easy. You can see the form that's a straightforward form here. So I'll start from the top. So there's an outbreak ID that's auto-generated, so you don't have to do anything with that. You can look for your mission or duty station here. And then you can also tell us whether the outbreak is active or inactive. I'll show you later how you can update all this information. But right now, imagine it's a new outbreak that you're putting in. So you're going to look here for the disease type. So you can see different types of diseases here. And then if the disease is not here, you can also just put any suspected confirmed outbreaks. So a lot of these boxes are narrative, meaning that you're just going to type in and tell us more about the outbreak. So for the under current status, the first question is please provide a summary or a report of this outbreak. And then also additional question, are identified cases vaccinated? So over here, you just want to write that, we have 5 cases of food poisoning, they all went to a party, whatever you want to tell us about the outbreak, how many contacts, you just summarize and just write as much information as you can in here, okay? Number 2 is the date that the cases were first reported. So you can pick a date so that find the earliest time that the cases were sick and reported in. Over here is the total number of cases. So total number of lab confirmed cases that are symptomatic, total number lab confirmed asymptomatic, total number of suspect probable cases. So in the first time, many cases would probably be just suspect or probable cases. Maybe you have no lab confirmation. You just put a number here, okay? Whatever number you want. Then if you have contacts, if it's something that spreads and there are contacts that were identified, so maybe they were in a household, let's say for like COVID, right? There's a household of 10 people. So 10 people are potentially exposed to the sick person. So you put your number in there, whatever. Geographical location, so just write down, where were these cases happening, which part of the city, which part of your area. Specify the population that they're from, so there's a drop down. So are they uniform personnel, non-uniform personnel, a mix? Okay, you can pick. Please describe the population affected. So just write down more information about the population. So if it's a uniform personnel, which contingent, maybe they all played a sports game together. Maybe they had a party in the UN office, which office was affected. So describe a little bit about who are the people that are being affected. If they're uniform personnel affected, what's the nationality of the personnel? And you can find different nationalities here in the drop-down. Okay, then you go to 3 different sections. So the first section here, it says common factors among the cases. So, think about it. Were there any common factors that you notice among the cases? For example, like I said, maybe they all shared a meal together. Maybe they all went to the same party. Maybe they were all on patrol together to the same location. So if you need some examples, you can look under Annex 1 here. If you click Annex 1, it will come out and says that, what are some examples of potential common factors? For example, occupation. Did a lot of them belong to the same occupational group? Were they all healthcare workers? Were they all food handlers? Were they all some kind of workers? shared space. Did they live in some area, accommodation together, same barrack, same dormitory, same workplace? Travel history. Did they travel to the same place internationally, domestically? Close contact in confined space. Did they share a closed space together? Did they share a bathroom, dining facilities? Did they participate in some group activities together, like a religious meeting, recreational activity? Did they have some close connection with a local community that may have also been sick? So these are some examples of potential common factors that are found in Annex 1 that you can look at if you can't think of any common factors. Next one is potential source or origin. So if you already know like what could be the origin of this outbreak, for example, maybe it's a water supply, as a food source, you can write it down. Again, we have Annex 2 here, which will show you that, what are the potential exposures that people can have. Maybe they were all in healthcare setting together. Maybe they were in some accident together, road traffic accident. So maybe there's what you suspect are potential causes of them all being sick. And then the third section is what are the control measures that have been taken? So here we say, please provide information on the measures that have been already taken for your outbreak. So what you've already done at this point. And then the next section is, are there upcoming measures that you are planning? Maybe you plan to contact all the contacts and tell them about the situation, put them in quarantine. So again, Annex 3 gives you some examples of what measures that you may have taken. Maybe you restricted their movement. Maybe you changed the protocol for the food. Maybe you stop some patrol. Maybe you cancel sport activities. You increase the hygiene measures. Maybe you isolated cases and did contact tracing. So these are all potential things that you can put into your form here. So it's just a simple form like that, and then you just press submit, and then it'll be submitted to us, okay? So then I'll just go back and show you that if you want to update your case, so there's some development in your case, you can actually do that. So you go to update existing outbreak here, and you can see different case numbers here, and you'll always have like let's say it was an influenza, a flu illness, a flu outbreak. So you can actually, you have to check what was the ID number. So you should know what was the ID number that was generated. And then you can click, and then you can essentially go back and change the data, update the data. Okay, and it'll be reflected. And on our side, we will see that you have updated data, and then we will update the system accordingly. Okay, so that's it on this. Maybe for now, is there any questions from anyone about this? It's pretty straightforward. We will send all the details to you by after this as well. And there's a video recording, like what I did, but a more professional video record that you can read through and listen and share with your people. Celine, yes, you want to ask a question? Celine, your hand is up, I think. Or anybody else? If not, then Alexandra, can I just invite you to share the report? So I want to show you something that we're working on. It's not yet ready. Okay, so a question came, who has access? Right now, it is the CMOs and the UN clinic doctors. But when we send you the email out, we will ask for the CMOs and the UN clinic health managers to identify for us who they want access, and we can give whoever wants access, okay, to fill it in. Question, location of the event. Is it possible to have options to provide by geo coordinates? So right now, no, but that's a good question. So something that maybe we can work on later. Right now, you just simply type in the city, or whatever. If you have the geo coordinates, you can put it in there as well. Currently, we don't have the system like that, yeah. Will arthropod-borne illnesses be applicable here? So yeah, so anything that is an outbreak situation. So just bear in mind that we're not collecting any like specific case with names and all that here. This tool is just simply for us to figure out trends in the outbreak space and then for us to support you. If we see something unusual, we will be able to straight away contact you and help you and give you any support you need. Yeah. So we had sudden increase in upper respiratory tract infection, and when we checked with WHO, did not confirm any outbreak. Correct. So if anything like that, like sudden increase of malaria, dengue, upper respiratory infection, colds, infections, you should feel free to put into system. And then we, and obviously if you need us to straight away, we will also contact you straight away to talk to you about how it might be dealt with. Yeah. Again, just to bear in mind that for the term outbreak can be very loose. An outbreak really is just whatever is increased from what's regular, okay? From what you're seeing. So like I said, if normally you don't have any Ebola, and most places shouldn't have, so even one case of that is actually technically considered an outbreak. So anything unusual that you're seeing a lot of people having vomiting and diarrhea, you're seeing a lot of people falling sick, you see a lot of people suddenly need to be hospitalized, obviously those very extreme one, I think you'll tell us straight away, but anything and everything, you can just put it in, okay? Question about, can we see compiled data of an outbreak across various regions? So yes, so I want to share with you, after all these questions, I will share with you a report, what we will do, and that's what we did for COVID, is that basically all of this report every day was actually sent to the Secretary General and was sent back to you guys as well. So we could see across all the missions, all the clinics, we could see who is having outbreaks and what's happening and what are they doing with the outbreaks, how many cases and whether cases went up or down and stuff like that. So we are right now working on those reports so that once the system starts running, you will also be able to automatically see these reports for yourselves on what's happening on your level as well. Okay. Is there a standard format of questionnaire where we can also perform detailed line listing and conduct outbreak investigations? Yes, actually, we do have some internal forms that we can share if people want that. I can share that as well. I'll put it down for that. But a lot of these are pretty standard kind of information collection, and then how to perform line lists for the contact tracing. There's a lot of information out there, like on the internet and all that. WHO probably has this as well. But we can share with you some common questionnaire that you can use for yourselves. Okay, you don't really have to send it to us. For all kinds of outbreaks. But when there's serious outbreaks, like when we had a lot of Ebola cases in West Africa, we use those type of forms for us to track it. But these forms that I'll send you will be for your internal purposes. Yeah. Okay, let me just continue the questions. If we report an outbreak and WHO does not confirm, how can we communicate this with different UN offices? Yes, so just to say that all of these outbreaks, you don't have to wait until it's laboratory confirmed. It's just that if you notice or people are reporting to you that there's a bunch of people that are somehow clustered, and the cluster is in person, time, and space, or so it could be clustered in terms of all similar type of people, or it could be clustered similar type of area, a place, or it could be clustered in terms of time. They're all in one day. You have 10 people all getting sick all falling ill, all fainting, all vomiting, then you know that there is a problem somewhere. Okay, so you can just use this form. This form can be used to report any suspected thing. It doesn't have to be laboratory confirmed. It doesn't matter, because on our end, it's just really for us internally that we see that there's some issue going on. And then we will start to communicate with you, and you can keep regularly updating the form as well, and we can keep track of how this thing is development. And then later on, if you do get a confirmed diagnosis, you can go back to update your form and say in the report that right now we already confirmed that this is, meningitis or something like that. You can write it in your form, and it'll constantly be updated. Okay, the system will update itself. Okay. Okay, ideally, MO should report about any outbreak to you through the office of the mission CMO. Is that correct? So yes, so currently the CMOs have the main access to the system, but like I said as well, depending on how the CMOs want to do this, they could give the FMOs access to the system. They could give specific people access to the system as well if they want to. So we will write a note to all CMOs, all UN health managers, and they'll have to decide who they want access to give to the system. Okay. And whatever information they put in, we would assume that it has been cleared by the CMO or the health manager. Okay. Can we report based on clinical findings only, like cases of watery diarrhea, for example, that could be cholera, because we don't have testing capacity? Yes, you should. I mean, a lot of places, as you guys know, cholera is usually called acute watery diarrhea. It's not actually diagnosed as cholera in many of your areas. So it's going to be just acute watery diarrhea, and that's what you should be reporting to us. You can say that you suspect it's cholera. You don't have any diagnostic capability. But yes, so those things you definitely should report to us. Yeah. Okay, please email the standard question. Yes, we will email that to you, Tandin. Okay, any other questions? If not, I will ask Alessandra to open up the PDF file. Alessandra. Okay, great. So I just wanted to show you what it looked like during COVID. Okay, and again, I said that this report was generated daily by the system, and it was sent daily every day to Secretary General for almost a year and a half, basically. So we will now be changing this report to make it suitable for all of your non-COVID outbreaks as well. Okay, but I just want to show you what it looks like, and this will be what you guys will get as well once it's ready on our side. I don't know if Alessandra, can you zoom it bigger? Or people can just zoom themselves, but I think you can also just zoom it a little bit bigger so you can see. Yes, just from the top, I'll show you guys. Okay, good.
Is this better?
So, yes. So just to show you this report, that essentially what it is that these reports will be split up. We have mission report, and then we have the UN clinic reports, just because they're kind of different stakeholders in our minds. But so this is an example of the mission reporting. So, we have a little bit on top about, about this report, what this report's about. And then if you go down, if you scroll down, you'll see individual missions. So let's say, let's say MINUSCA, right? Previously MINUSCA, or you can't see. Can all of you see the report or not? Someone is saying they can't see. Yes? People can see the reporting or not? Okay, good. Okay, so I'm not sure why Swapan you can't see, but okay, good. All right, so so just to say that if you see, let's look at MINUSCA. So you see MINUSCA in gray. So all the outbreaks that you have will be under your mission, okay? And it will all have different ID. So you see the first ID, it says COVID dash MINUSCA dash whatever. So that is the specific ID for that specific outbreak. And then you look on the right, you see it says status. Is it active, inactive? the medium. Okay, don't worry about the medium, but so there will be a note whether it's active or inactive. And basically, once your outbreak is done, you can go back into the system and make your outbreak inactive. Okay, you find the ID again and then go back and make it inactive. So you will see in this summary here, when the information was updated, the location, right? It says Bambari Car. They'll say what population, okay, Nepal battalion, what HRBP contingent, and then you see here outbreak summary. So here, so I'll just read you this example so you can see at COVID how we did it, right? So this outbreak summary says, this is now a 6 PCR confirmed, all asymptomatic, brackets, no context outbreak among the Nepalese battalion reported to DHMOSH on 25th of January. The majority of all these cases are among the new arrival groups. All are fully vaccinated and they live in the same area, share barracks, offices, vehicles, and some of the arrivals, some of the arrivals were developing symptoms. Targeted PCR tests were carried out. Contacts were identified. Some were tested PCR positive. All cases, all contacts have been isolated, quarantined under regular monitoring of COVID-like symptoms, strictly implemented by MINUSCA Medical Section. The mission has reinforced the IPC measures. Investigation team was sent to assess the situation at the camp. The office is following DHMOSH recommendations to control the spread. Okay, so I just want you to be aware that the way we do it here internally is that we will read through your report. We will write a summary. So this sort of summary is written by us on our end. It's not going to be directly verbatim from you, so you don't have to worry, okay? Because we will look at your situation and then we will write like a nice report, and then kind of it'll all go in here so that the senior management, whoever, Secretary General, whoever wants to see it, they will understand currently what is the current situation of the outbreak today as reported by you guys. Okay, so the information, the raw information is going to come from you guys. We're going to read it, assess it, and we're going to summarize it so that management can look at everything properly, and we can look at everything and see what holistically what's going on in all the different duty stations, missions with regards to these outbreaks. Okay, so that's all I have. I think Alexander, you can close. Oh, actually, sorry, Alexander, if you can turn to the next page, you can go to the next page. I just want to show the end as a summary as well. Yeah, so it says here, list of field outbreaks reporting COVID outbreaks. So we'll have a sort of summary here so that we can see at a glance, which mission is struggling with what issues, what outbreaks, and all that. Okay. Okay, thank you so much, Alessandra. You can close that out now. Okay, question. Will there be any intervention from your side, diagnostic kits, vaccine, to address the outbreak? So exactly. So the whole purpose of this is so that we know what's happening, and that if there is anything serious, major serious outbreaks, that we can help you guys. Or if you need help, of course, you can contact us anytime. But depending on what the outbreak is, different outbreaks will need different type of intervention. Yeah. The report should also be generated from EarthMet because we enter data. Yes. So just to explain that EarthMet is different from this system. This is really an outbreak reporting system. So it's really just focused on the outbreak itself, not focusing on like individual names, cases. We just want to understand broadly what's happening with that one outbreak or 2 or 3 outbreaks that's in there. We're not interested in names of cases, individual cases, what's happening, okay? Just this is really on an outbreak level. Within EarthMet, yes, correct. You have to report your clinical cases, the clinical situation into EarthMet. But EarthMet does not have a system right now to pick up on kind of the broader outbreak. Hopefully in the future it will, but right now it doesn't. That's why we have this system, okay? So during COVID as well, we had to develop this because EarthMet wasn't able to generate that kind of system. Yeah. Okay. Any other questions? If not, I think we're done. I don't have anything else to add. Yeah.
We have the polls to
Oh,
launch.
yes,
the
sorry. Yes.
questions and
So we
answers,
now
yeah.
have a poll where hopefully you will remember what I said in the last half an hour so that you can fill it in. But
Okay.
just a reminder that you should also just report any outbreak that you have as soon as possible. Obviously, because we want to be alerted, and it's okay if you just have suspect cases, because that's the whole point. We don't want to wait until it's like confirmed like 10 days later. You don't have to. You can just tell us straight away so that everyone has an awareness that there's some activity going on, and we can send resources if needed and things like that. Okay, so back to you, Alexandra, or to run the poll. So we'll have a poll
Yeah,
of 4 questions.
we have the poll already here, my dear. The first question is, what is the purpose of the outbreak reporting form, namely ORT? The first possible answer is to track only COVID, to report outbreak efficiently and effectively, to provide general health information, to monitor weather patterns. Okay? Start answering. Please answer in the poll. You have it in your screen. Okay? Okay. Let's see. If I can see some okay. Yeah. Okay. Let me check the chat. We have some bees in the chat, Esther. Okay, guys.
Okay.
Start answering. Okay, we are 135. Okay, I want to see. They said nature of the outbreak. They keep answering me. And the correct answer is, my dear?
To report outbreaks efficiently and effectively.
So is the answer B? Am I correct?
Yes, B.
Okay, thank you very much. Alessandra or Alessandre, please, the second question. Okay, the second question said, where can you find examples of potential common factors in the outbreak? Answer A is Annex 1, B is Annex 2, C is Annex 3, and D in the main form section. Okay? Okay, please start clicking or answering in the chat. Okay. We have a lot of A's, but we have some D's as well, Esther.
Yes,
okay.
So it's should I take the answer or not?
Yes, please, go ahead.
Oh yeah, so it's 1, the first one, Annex 1, which is A, is where you find the common factors.
Very well, the next question, please. What is the first step under the current status section of the ORT? A, select the type of disease. B, provide geographical details. C, submit the report. And D, provide a narrative summary of the outbreak. Okay, guys, start answering. A, select the type of disease. B, provide geographical details. C, submit the report. D, provide a narrative. Okay, questions are coming along, Esther. D, more D's. Okay, and the correct answer is, my dear Esther?
Sorry, D, yes. provide a
Very well.
narrative. That's where the first writing starts. So you just have to write stuff in there.
Very well done, guys. The next questions, please. What is the first step when you should file your first report in the ORT after an outbreak is suspected or identified? A, you promptly as soon as possible. B, upon receiving confirmation from DHMOSH Public Health. C, after completing an initial investigation and assessment. Okay? When should you file your first report in ORT after an outbreak is suspected? Promptly, as soon as possible, upon receiving confirmation from DHMOSH Public Health. C, after completing an initial navigation, investigation, and assessment. Okay, Esther, we have a lot of A's. Okay, what is the correct answer?
Yes, the answer is as soon as possible, because you can always go back and update any information. So just feel free to put it in, and then later on, when you've done more investigation assessment, you can go back and keep updating it according to your ID. Yeah.
Yeah, very well. You know, we have 85% answer A. So I see that they have been paying attention to your presentation, Esther.
Yes, very good. Good job, everybody.
Next,
Okay, thank you.
Next question, or this is the last one?
More.
There is one.
Yeah.
Alessandra, is there more question?
I think only
No,
four.
that's it.
Only
That's
four.
It's just to
Okay.
rate the presentation now.
And your presentation have been rated, my dear, 4.8. Okay.
Thank you.
Thank you very much, Esther. It's always
Okay.
a pleasure to have it with us.
Thank you. Yeah.
And now
we're
you know.
done early, 15 minutes to relax.
Okay. Thank you, guys. I would like to wish you
guys.
a nice week ahead. Bye bye. Have a good day. Bye bye. Bye bye. Bye bye.